lovely people, welcome back to my channel. This is Abdul Malik. Here we are going to talk about endocarditis. If you have not subscribed yet, kindly subscribe and then hit on the notification button for a new video anytime we have them. Today we are going to look at the structure of the heart and then some of the conditions associated with them, especially when it comes to endocarditis. Remember, when it comes to the heart, we've spoken a lot about it in our previous video. So please kindly just go and subscribe and then you watch them. Okay, it's very, very important. Information that we delivered there. Okay, now when you talk about the heart, you know that the heart is made up of 4 chambers, and then when it comes to the layers of the heart, we have 3. We have the epicardium, we have the myocardium, and then we have the endocardium. Today we are going to talk more about the endocardium. When it comes to the epicardium, okay, we have the pericardia, part of it, which under it we'll talk about the peritha, the viscera, and then pericardial sac, where about 20 ml of water, that try to cushion the heart anytime it pumps. It is very, very important. Okay, and then you know that when it comes to the outer part of it, which are very tough, the peritha, that protects the heart from any sort of injury. These points are very, very crucial when it comes to the heart. Okay, and then the endocardium, today we are going to talk more about it because we are going to deal with endocarditis. And then when we talk about endocarditis, you know that endocarditis is one of the problems when it comes to the heart, especially when there is an inflammation or invasion of organisms. Whenever there is an invasion of organisms, be it bacteria, fungi, or whatever that is likely to cause infection there. Okay, so we are going to talk more about it. And remember, when it comes to endocarditis, we have two main constitutive organisms, okay, which are bacteria, okay, and then we say that they are the staphylococcus and then the streptococcus. Now, these two bacteria are very, very crucial because they have ability to cause a very serious infection. It's not only the heart, it can affect the kidney too as well, and some part of the system. Okay, so today we are going to digest this. Now, when you say endocarditis, okay, now the endocarditis has to do with the inflammation of the endocardium. When you take the heart, for instance, okay, you know that the myocardium is the bulky area of the heart, and then after that you go to the inner lining of the heart, which has to do with the endocardium. Now, whenever a bacteria or any organism invade this area called endocardium, infection occurs or inflammation occurs, and that is what will lead to This is what will lead to endocarditis. And remember, the valves are also part of the endocardium. So this condition, whenever they occur, they mostly also affect the valves. So sometimes when it is too much, when it is too serious, what mostly happens is that there is a likelihood that the valves can have a problem and valve insufficiency can occur. They are very, very important. Now let's look at the causes. We all know that when it comes to the endocardium, we've spoken about the bacteria like the staphylococcus and the streptococcus. They have a very serious effect on in this condition. But some of the causes can lead to the invasion of these particular microorganisms. Okay, what are the things that can lead to the invasion of the bacteria into the blood before they get to the heart, to cause the endocarditis? Now, IV drug uses. When it comes to those people who are addicted to drugs, okay, the use of the heroin, the cocaine, and those kind of drugs that has to do with the IVs. What mostly happens is that these people, anytime, because they don't have the money to buy a new syringe or needle, they normally share them. And then if any of them have any bacteria, okay, it's the likelihood of them of infection, the likelihood of the person also share it to the colleague is high. And also remember, that same syringe can be stored and then it can be used again. And by so doing, bacteria can be introduced into the blood to cause an infection, which will intend to also move into the endocardium to cause infection. So IV drug uses are part of it. And then people who have ever had previous valve replacement, previous valve replacement or repair of valves with prosthetics. This is one of the things that is more critical. A lot of questions come under this. We'll talk more during the end of the video. Okay, we'll try to solve questions on them. So take note of that. Okay, when it comes to the valve replacement, during the process, invasion of microorganisms can be present, and then the introduction of the microorganism can lead to the infection of the endocardium. So they are very, very important. And then IV line can also be part of it, and some factors when it comes to infections like the GI system infections, the kidney infection. I've already told you that the microorganisms can affect the kidney, and then by so doing, they can also move through the through blood, through homogeneous spread. They can find their way into the heart to cause endocarditis, and then systemic infections too can also lead to this particular problem. And know that, please take note, dental problems, one of the NCLEX areas that they normally set question on when it comes to endocarditis and valvular heart disease. Take note of this. Remember, the valves are also part of what? Of the endocardium. So sometimes those two conditions, they are interrelated because one of them can lead to the other. Remember, endocarditis can lead to valvular heart disease. Because of that, the valves will be what? Will be part of the condition. Take note of it. So, do you know why sometimes we say that dental procedures can lead to endocarditis or valvular heart disease? It is because, remember, whenever there is oral infection or dental problem, and then remember there is this particular organism called whether streptococcus or staphylococcus. Now, during the procedure, they can find their way through the blood into the heart to cause infection. And it is one of the areas that NCLEX love asking a lot. So take note of this. So dental procedures can lead to this particular condition called endocarditis. Sometimes the question will be like, the person came with the presenting symptoms of the endocarditis, and then which of them will you follow up? And then you see that they say the patient went in for a dental procedure about 3 to 6 months ago. The moment we see 3 to 6 months ago, we should tell you that, okay, the condition might be endocarditis, and it might be as a result of the dental procedures within 3 to 6 months ago. So please take notice of this. They are very, very critical point to take notice of. Now let's look at assessment of endocarditis. When you talk about assessment, we are talking about the signs and symptoms, presenting symptoms, findings, and then observations. These are all what leads to this particular problem. So we are going to look at the results of endocarditis, which is the assessment. Remember, we are talking about fever. And then in as much as we're talking about infection, fever is present. So there's going to be increase in temperature. And I'll take note, in NCLEX exams, if they're talking about infection in prioritization, and then you realize that, okay, the temperature among the options given for the question, the temperature is high. It is an expected finding because you're talking about infection. So take note, infection will be there when it comes to endocarditis. And then anorexia can be there. Then weight loss. Weight loss can also be something that is very, very common. Sometimes even loss of appetite and the metabolic activities, all those kind of things will try to be impaired. And then remember, when it comes to this, weight loss can be the results. And then cardiac murmurs. Cardiac murmurs upon auscultation, you'll be hearing cardiac murmurs. And take note, these two particular cardinal symptoms of endocarditis, take note of them: osseous lesions and then Janeway's lesion. Janeway's lesion is very, very important, and then osseous lesion in endocarditis are very, very important. This symptom can be used to diagnose endocarditis. So please take note: osseous lesions and then Janeway lesion. Take note of them. Now, what is osseous lesion? This one is a reddish, tender. Take note, a reddish, tender lesion. Okay, that normally happen on the part of the fingers and the toes. On the part of the cinders, on the part of the sorry for this. Okay, on the part of the fingers and the toes. Now take note of this. These particular osseous nodes are very painful. These are one of the things that you can differentiate it from Janeway lesion. They are very painful. Take note. And then they are tender. Take note of that. They are tender, and they mostly happen on on the fingers and the toes. Now, let's look at Janeway lesions. Janeway lesion, that one is non-tender. Take note. They are non-tender, and then they are non-tender hemorrhagic lesion. They are non-tender hemorrhagic lesions on the fingers, toes. nose, and also the earlobes. Take note of that. And one thing about it is that when it comes to genital lesions, when it happens on the what? On the palm, what happens is that they spread across the palm. But the osseous node mostly happen, okay, on the tip of the fingers. So the fingers has to do with what? With this one. That's how this osseous nodes mostly occur. But when it comes to the genital lesion, the lesions are spreaded across the what? The palm. So take note of that. Okay. So in the question, whenever they are explaining this, you should be able to what? To understand it and what? And answer it correctly. Take note of that. And then there's going to be what? Splinter hemorrhage in the neighbors. Splinter hemorrhage in the neighbors is also one of the cardinal signs and symptoms of endocarditis. And then splenomegaly. Take note. Now, there's going to be enlargement of the spleen. I've seen a couple of questions when it comes to this. Splenomegaly is part of the endocarditis, and it is an expected finding in the assessment. So in prioritization, this one we don't normally consider because they are expected in what? In endocarditis. If in the option, there are more options that are more critical than this particular one, you choose that in prioritization questions. Take note of them. We'll be looking at some of the questions after the video. And then clapping of fingers. Clapping of fingers can also occur. Take note of this. They are very crucial when it comes to endocarditis. Now, we've spoken about the differences between the symptoms, right? Now, we are going to look at the intervention of endocarditis. Whenever intervention, endocarditis occur, what will be the intervention? Remember, we have to also try to what? To manage rest. It is very, very important. You need to balance rest with activity. Rest is very, very important because the heart has been affected. We don't want to put more pressure on the heart to cause a very critical problem. So, adequate rest balance with activities, to prevent thrombus formation. Remember, the heart murmurs. When it comes to this particular one, due to the valve, okay, problem with the valve. I told you about this particular valve. Okay, now, heart murmurs. By so doing, pumping action or movement of blood is sometimes restricted. It's slowed. Because of that, clotting can form. That small clotting, thrombus formation can be present. So take note of that. Okay, because of this, we need to try to balance activity with rest to make sure that the patient, okay, is able to relate. That exercise also increases cardiac output. That is why we need to balance it with what? Rest. And then we monitor signs of heart failure. Remember, the heart failure has to do with what? Ability to pump blood into circulation. Now, if the heart murmurs occurs and then there is inadequate blood supply to the heart, remember, heart failure is occurring. That is why we say that you have to monitor for signs of heart failure, like generalized edema, jugular vein distension, and then when it comes to the weight, there's going to be weight gain, and then sometimes confusion and stuff will start occurring, and then the lungs will be congested when it happens at the left side of the heart. Remember, the respiratory symptoms like respiratory distress, dyspnea will all occur when it comes to the heart failure. So you have to monitor for any sign of heart failure in this particular condition called endocarditis. They are very, very important point to take notice of. And then you monitor for renal emboli. Remember, when renal emboli occurs, because we say that the member can also lead to this particular emboli because of the small clot, and then they can move anywhere to cause obstruction. So you have to monitor it. So anytime in the symptoms we see something like a flank pain, okay, that radiates to the groin, and then hematuria or pyuria, then it means that, okay, the kidney has been affected due to this condition. It's one of the complications that mostly occur. So we need to rule out any sign of what? Complication of endocarditis, and what? Renal emboli is one of them. And then we say that when it happens at the central nervous system, you need to monitor for confusion, dysphagia due to the emboli. It can also affect it. We need to monitor all these signs to rule out any complications of the endocarditis. So take notice of them. And then when it happens to the pulmonary emboli, you should also monitor for any sign of what? Pleuritic pain. Pleuritic what? Pain. That means that there's going to be what? A pain at the chest pain. They are very important, and dyspnea and coughing. Remember, it can lead to heart failure as well. So when all these things are occurring, it means there is a problem called what? Endocarditis, and the complication has really occurred. And then we need to also assess the skin. When it comes to the skin area, you remember the mucus, okay? The mucous membrane are very important, and then conjunctiva for any petechia. That means that it's going to be what? Small what? Breaking vessels when it comes to this, okay? Due to the emboli, they can cause a very serious effect, okay? Especially in the eye. All these things are what we need to what? Pay more attention to. And then we need to assess the nail beds. The nail bed for any splinter hemorrhage. We spoke about the splinter hemorrhages. No, there's going to be some small hemorrhage, okay, on the finger, on the finger. So we need to try to monitor the finger for any sign of what? Bleeding. And then we assess for osseous node. Remember, osseous nodes are painful, painful tender lesions, okay, and mostly appear on the what? On the fingers, as we spoke about, okay, and it does not also across the fingers. So on the tip of the fingers and the what? And the toes. Take note of that. That's what we spoke about it. So you monitor for any sign of that when it comes to endocarditis, and then we know that the condition is occurring. And then we say that we need to assess for any sign of what? Genway lesion. And that why we are speaking about it, especially of the fingers, toes, earlobes, and also the nose. And then we assess for any sign of what? Clubbing of fingers. Clubbing of fingers. Remember, and then we need to administer antibiotics. Now, sometimes the question will be like this. When a patient can, which of them is the most important point of management when it comes to take note? One thing that you should always pay attention to is that we need to make sure that we institute IV line. Take note of this. NCLEX love asking questions about it, because this condition needs to be treated with antibiotics. Because of that, we need to institute IV line. Take note. Antibiotics is very, very important, because it is the main or the point of treatment to be able to reduce the risk of infection when it comes to this particular endocarditis. So please take note of them. Antibiotics is very important. So because of that, we need to do what? We need to institute IV line. Take note, we must solve questions on that. Now, let's look at the education that can be given to the patient and then the relative who is taking care of the patient. We need to teach the patient, okay, with regards to aseptic techniques during IV medications. During IV medication. And the nurse is also, also has to know about this particular one, okay? The nurse also has to know about it. They are very, very important. And then you monitor IV catheter site, okay, the IV catheter site for any sign of infection and report to cardiologist. The reason being that you know that this infection can contain, okay, with this particular infection can also be as a result of staphylococcus or streptococcus, and they can find their way into the heart to cause endocarditis. So anytime we see any infection around the IV line site, we need to try to report to the cardiologist for further intervention or for proper antibiotics, okay, for the patient. And then we need to monitor temperature and report any fever. It is also very critical. Take note. Anytime the patient temperature rises to that extent, you remember, it means the infection has not been cured, has not been treated. So we need to what? We need to inform the healthcare provider to whether there is a need to increase the dosage or to change for a new antibiotics. And then please take note. Because of the splinter hemorrhage, in NCLEX, anytime there is hemorrhage, take note, the use of what? A soft toothbrush. A soft toothbrush is very important. Take note of that. So you should what? Always try to instruct the patient to do what? To use a soft toothbrush. If not, okay, remember the mucosal lining, the mucosal membrane also have a very serious problem when we spoke about the skin. So because of that, a soft toothbrush is very important. Don't use a hard toothbrush because of the risk of what? Bleeding. And then we can also give a prophylactic antibiotics before dental procedures. Please take note. Anytime a patient is going for any form of what? Dental procedures, he or she is supposed to what? Take antibiotics. So he needs to what? To inform the person doing the procedure for this. And then if you have ever had this condition, it's better to do antibiotics before any dental procedure. Please, these are the NCLEX areas. Remember, and then you teach signs of what? Heart failure to as well, as we spoke about it. Ladies and gentlemen, now let us look at some of the questions involved when it comes to this particular condition. Now, question 1. Okay, you are providing discharge teaching to a patient being treated for endocarditis. Which statement by the patient demonstrated they understood your teaching about this condition? It means that we are looking for what? The important message that the patient will demonstrate, indicating that he or she has understood the condition itself, called endocarditis. Now, A, I will stop taking the antibiotics once my fever is gone in order to prevent antibiotic resistance. This is very wrong. We know that it is very wrong. Okay, so take notice of that. And then B, I will only wash my hands with soap and water. Not only, take note of absolute words in NCLEX. Only, absolute words, completely, never. Take note of these words when it comes to NCLEX. They are all absolute words, and they are negative, okay, when it comes to NCLEX. So take note of them. And then B, C said, I will inform my dentist about my history of endocarditis prior to any invasive procedure. And that is the last point we raised. You need to make sure you inform your dentist, because a dental procedure is going to occur. Remember, we explained that one when it comes to dental procedure, for any sign of for any important antibiotics to be taken. And the fourth one said that I will avoid eating fish and organ meat. No. So the answer choosing here is I will inform my dentist about my history of endocarditis, okay, prior to any invasive procedures. That is the correct answer. So option C is the answer. Take notice of that. Now, let us look at one more question. Okay, now a patient is receiving treatment for infective endocarditis. The patient has a history of intravenous drug use and underwent mitral valve replacement a year ago. The patient is scheduled for a tracheoesophageal endocardiogram tomorrow. On assessment, you find tender, listen, you find tender red lesions on the patient's hands and feet. You know that this is a common finding in patients with infective endocarditis. It is true. Okay, and it's known as, now, A, Janeway lesions, B, Roth spots, C, Osler's node, and then D, Trossel's sign. Now, we all know that Osler's node, it is the one that is tender. Remember, Janeway lesion is is non-tender. So you see how the differentiation can be when it comes to NCLEX. Remember, NCLEX is doable when you spoke about it. Okay, so the option C is correct when it comes to this particular condition. I like that. Now, let us look at another question. Okay, a last question. When it comes to this, now, a client who is diagnosed with infective endocarditis is admitted to the nursing unit for observation. Which assessment data should the nurse report immediately to the client's healthcare provider? So what will be the assessment data that you need to report immediately? Take note. Let's see them, the options. Select all that apply. Now, 1. White blood cell count 12,000 per cubic millimeter. You know, when it comes to this particular condition, remember, there is fever, and it is an expected finding. Okay, now, option 2, fingers that appear clapped. Clapped fingers is also part. Take note, I told you that in prioritization, clapped fingers are part of of the condition. So, fine. Is it all that, thing that we should worry about? Okay. Now, then option C or 3, right extremity paralysis. Is paralysis part of endocarditis? There is something fishy. Then this is not part of it, so we need to further investigate. So it means that the option C is part of it. Take note of that. The option C is part of it. All right, so right extremity paralysis, we need to We need to report to the healthcare provider, because it's not an expected finding in this particular condition called endocarditis. Now, option D or 4, pain and coldness of left foot. Coldness, pain. Fine, the pain can be there, but the coldness, that means that there might be some form of circulatory impairment to the extremity. We need to rule out what is the cause of it. So it means that, okay, we need to report this particular one to the healthcare provider. And then let's look at the last one. Temperature of 101.9 Faraday or 38.8 degrees Celsius. No, it is still an expected finding in endocarditis. Remember, there's infection. WBC will go high, and then temperature will go high. So it's an expected finding. It's an expected finding. So when it comes to the right extremity paralysis and then pain and coldness or coolness to the left foot, it is not an expected finding. So we need to investigate that one. So we choose what? Option C and D, or option 3 and 4. Take note of that. So ladies and gentlemen, this brings us to the end of today's class. Remember, NCLEX is doable. You can contact us for your content. Thank you very much once again when it comes to NCLEX. Remember, we are there to help you out, okay, with the firm teaching you NCLEX and the best that you can get to pass the NCLEX successfully. Have a nice day, Aris. Bye-bye. Thank you for having me once again. My name is Abdul Malik.